Hi, I'm Dr. Adam Smith, orthopedic surgeon specializing in hip and knee replacement at OrthoArkansas here in Little Rock. So how do you know when it's time for a hip or knee replacement? Well, the goal of treatment for us is to try to get your pain under control. And we try to do it without surgery for as long as we can, using a combination of medicines, physical therapy, injections, stuff like that. The decision for surgery is really when we can't get your pain under control anymore. So when you've exhausted all those options and you are still hurting and in pain and your quality of life is going down, that's when we start talking or having the conversation about surgery. So signs that you would be ready for a hip or knee replacement would be just that your pain is not able to be controlled. You're taking anti-inflammatories every day, you've been doing physical therapy, or you can't do therapy because it hurts too bad, or you're getting injections in your hip or knee and they're just not cutting it anymore. So when you get to that point, and again, your quality of life is declining and you start feeling like your life is more of an existence instead of a life, then it's time to consider surgery and we can help you with hip or knee replacement.